Now let's head into our next story.
In the treatment of cancer, we utilize three main treatment modalities: radiation therapy, surgery, and chemotherapy. I think most people are familiar with surgery and chemotherapy or different medications, but radiation therapy is a treatment modality where we use different forms of radiation. People are familiar with chest x-rays and CT scans and MRIs. Well, with the ability to use very high energy in a very focused manner, we can deliver radiation therapy in a way that benefits the patient by killing the cancer cells preferentially to the normal cells, and do it in a way that many times is non-invasive. The three most commonly diagnosed malignancies in the U.S. today are lung cancer, breast cancer, and prostate cancer. Prostate is, specifically for men. It's an organ that only males have, but it is a type of cancer that has a lot of treatment options. Everything from watchful waiting and active surveillance, which is really no active therapy, to the other end of the spectrum with the most invasive treatment, which is surgical resection. In between, there is hormonal therapy, chemotherapy, cryotherapy, radiation therapy that can be delivered in multiple ways, including seed implants, external beam radiation therapy delivered over 9 weeks, and then radiosurgery. Radiosurgery has kind of surgery in the name, so we are looking to get the same type of effect as surgical resection, but we're doing it with radiation therapy, which is non-invasive. The treatment is being delivered in just 5 days in a way where the high-dose radiation is delivered just to the prostate. And outside of the prostate, surrounding normal tissues, whether it's bladder or rectum or the pelvic musculature, the dose of radiation falls off so quickly that there's really no meaningful dose a short distance away. The best way to kind of think of this in your mind's eye is that if you went outside, you're not going to burst into flames, with the sun's rays. But if you use a magnifying glass to bring all of those sun's rays together in one little point, you can start a fire. And that's kind of the principle behind radiosurgery, is hundreds of little radiation beams that are only focused on the tumor. Each of the individual beams is very weak and doesn't cause any damage, particularly to the skin, muscle, bone, on its way to the prostate. But where they all overlap, you now can deliver such a high dose of radiation therapy, it will ablate all of the tissue in that area, creating kind of a surgical effect, or in this case, a cure, to ablate the tumor, the prostate, and drive the patient's PSA down to 0, which is what everybody uses to follow patients after treatment, regardless of what type of therapy they have. How is it different than surgery? Well, surgery is obviously removing the prostate gland. Obviously invasive. It involves, surgically removing that organ and then kind of putting the patient back together again to function properly with regards to urination and other functions. Not every treatment option is appropriate for every individual. So, you first need to understand that each individual has a certain stage or extent of disease, and dependent on that, they may be eligible for different types of therapy. So there's a large range of options, and I think, it's the best interest of the patient to understand all of them as best they can and make a decision that's best for them.
We have to take a quick break, but stay with us. There is more Caring for Arizona when we return.